Hello, so in today's video, I'm going to be unpacking my sterile procedure kit. But before I get started, my name is Laura Nicole. A couple of things about myself is that I live in Georgia and I work for Northside Hospital as a OB/GYN nurse. My background includes excessive experience in surgical setting within our office, where I've assisted in procedures such as liposuctions, ablations, and as well as fibroid removals in office. Over the years, I've developed strong clinical skills and a steady surgical presence and a deep connection to patients to care for them. I'm passionate about women's health, supporting patients through every stage of their treatment, and continue to grow with the OB/GYN specialty. Okay, so I have right here my package full of instruments. I'm gonna go ahead and start taking some of them out. Let me move these out the way. I'm gonna get the table set up with all the surgical instruments. Put some scissors. And while I'm taking them out, I'm gonna be looking at each one of them, getting a feel what they feel like in my hands. Look at the handle placement and some thoughts of what they may be used for. Okay. I did not realize how many different types of scissors and tweezers there is. Okay. So like this section. Now that I have everything laid out on the table, I'm gonna lift up my phone and kind of show y'all what and how I have it laid out, just to make it a little bit easier on myself. So it looks like scissors, forceps are all gonna be right here is how I kind of have it, and then as well as right here. Then I have a couple of retractors, looks like suctions, and then tweezers and forceps as well down here, and then a knife. Okay, a couple of items that look interesting to me would be one of the retractors, a Dever retractor. To me, I think it could be used for deep organs or tissue retracting. I've seen it used in our office for GYN, for pelvic. It provides deep exposure in the large cavities without damaging any of the tissue. So for instance, can be seen for abdominal, chest, and pelvis area. Kind of surgeries I feel like it would be used for gynecologist, orthopedic, heart and lung, or maybe even a bowel recession. Another interesting item to me was the Richardson retractor. To me, off the top of my head, I've never seen one of these. It looks like it has like a, where it holds something out the way. And as well as, I'm not sure what this would be used for. Maybe like to handle, like, you know, hold on to it and then retract it back. Retracting, so it must be doing something with deep layers of the body, or as well as organs, moving them out the way. Possibly used in the abdomen area or pelvis. So could be used for maybe C-sections, appendix or tumor. And then the third item I thought was interesting was a Yanker suction tube. Kind of has two different types of ends. And this is the other end if you can see it. And then it has like an adapter. Definitely can be used for sucking blood or saliva out the way, maintaining a clear surgical field during a procedure. So I would assume in the mouth or throat. Surgeries could be for like ENT, dental, CPR, neck, head. This is where you would see this be used. Lastly, one of the items I thought was another interesting one for me was the Army Navy retractors. Looks like this. It's kind of like half of a square or a rectangle. So for me, I would have thought, you know, it's one of those node retractors. So moving something out of the way to hold while you're doing a procedure. So as you know, it's holding back skin or muscle, some type of tissue where the body, it could be used in the body for like the abdominal wall, neck, throat. Type of surgeries you would probably see this instrument would probably be a hernia or fracture exposure. Since we've covered 4 items that I think is pretty interesting to me to learn about and kind of estimate or guess what they could be used for, would be those 4 items. So for part 2, was moving on to the flashcards. I picked out 4 random flashcards that I'm going to go over. So the first index card is, what are the names of these instruments? Question 2, what are they used for? And this is what the picture on the card looks like. To me, the picture on the card looks like duct dilators. They look like long, thin metal instruments that kind of increase in size from one end to another. And then I would think they're used for removing gallstones. So on the back of the card, it says, what are the names of the instruments? Common bile duct dilators. Pretty close. That did say dilators, some type of duct dilators. What are they used for? Used to dilate the common bile duct so gallstones can be removed. Okay, so it came really close. To me, it seems very logical. Designed to fit inside a tube to remove what it needs to remove in a procedure. Okay. Let me put this one up. And my next card was, what are the names of these instruments? What type of tissues are these instruments used for? And this is the picture. So the picture to me looks like some type of scissors, short and long scissors. So definitely would be able to cut tough tissues. It looks like it'd be like strong, heavy duty surgical scissors that have a curved blade. So I'm gonna take a guess that these instruments are scissors. They're used, what type of tissues are the instruments used on? I would say, like I've used it in my office, so we've used it to cut IUD strings. What are the names of these instruments? Curved Mayo scissors, short or long. What type of tissues are these instruments used on? Tough, heavy tissue. So pretty logical. Seems pretty easy for me to understand that one. The next one was what type of instrument, what are the names of these instruments? What type of tissue are these instruments used on? This is the picture of it. So looking at the picture, I see what looks to be like fine tweezers with a grooved tip. So I'm gonna say tissue forceps, and they delicate blood vessels is what I think they're used for. So what are the names of these instruments? DeBakey tissue forceps. What type of tissues are these instruments used on? Delicate tissues and blood vessels. So they're gasping and holding instruments. Last but not least, what is the name of this instrument? And here's a picture of it. By looking at this instrument, I see a sharp 90-degree bend near the tip of the instrument. They look like scissors. So it must be used for something reaching around or working near vessels. On the back of the card, what is the name of the instrument? Fine right angle, used for clamping and for a procedure. Seems very logical to me. Kind of would think that I would be afraid of actually hitting something I would not want to hit because they're like a right angled kind of tip. So part 3, my final thoughts as I begin this journey into surgical tech, the sterile field. Every new concept, every instrument, every image opens a door into a world I've only seen from the outside. And now I'm learning what it truly means to be a part of a surgical team. There's something powerful about realizing that the tools I'm studying today will one day be in my hands in an operating room. And it makes the learning feel real, meaningful, and connected to a bigger purpose. Seeing all these instruments for the first time, like retractors, the clamps, the forceps that I have on the table, even more, is not only fascinating and eye-opening, but a little overwhelming because there's so much on the table that there's so much to offer and to be used to learn about. My first impression of each tool showed me how much I've already beginning to think like a surgical tech, noticing the shape, the structure, the purpose, and imagining how each instrument fits into a procedure. The image doesn't feel like a picture anymore. They feel like pieces of a language I'm learning to speak. I feel proud of myself of taking this step. I feel ready for the challenge, and most of all, I feel inspired by the idea that every lesson I learn will help me, a surgical team, contribute to saving lives. So I do thank you for watching or listening to this video, and I hope you'll have a great day. Bye.